My sister, the golden child, called me entitled for using autism accommodations. Then Mom took her side. The people in this story are myself, Hakan, 25, male and autistic. My sister, who I'll call Mia, 29, female, not autistic. My Austin, 26, male, ADHD, not autistic. My mother, 57, female, OCD, not autistic. And my father, 54, male, not autistic. To give a small backstory, my family is Norwegian and Danish, and we currently live in Canada. So we are not American or Canadian and do not follow what I've seen in a lot of American and Canadian family posts. This may change some views of how we do things within my family. I will say my sister adapted much more to the Western type of culture. She follows very closely to things on social media and does not often see anything outside of her own view of right and wrong as possible of being a gray area. The problem started when Mia brought up at a family dinner that I am now in residency as an MD and asked when the accommodations for my autism would drop. I told her they would not. As my autism did not go away, they will simply be changed to accommodate a work environment instead of a school. My Austin added that the only thing necessary to change is that I will be allowed to remove myself from certain situations other doctors would not if I feel I cannot give adequate care to a patient if they are offended by my diagnosis. While this is not common, many are able to tell I am autistic, and I have been in situations where a patient refused me based on my autism. Mia went on to say that I am very entitled to think I have the right to refuse a patient. I explained to her that mental health is covered by "do not harm" the rule by which doctors do their practice. I told her that if my patient's mental state or state of comfort is obscured by my autism, I cannot give them adequate care. I can assure them all I want that my abilities as a doctor are not different from any other doctor, but I cannot simply change anyone's mind. I also mentioned that my accommodation is more for the patient than for myself. It's mainly there so that I am not disciplined for a patient's refusal of my care for something out of my control. I told it's the same as when some racist patients that have come through the hospital and refused our Black or Indian staff. They have no more control over that than I do. My sister carried on saying that I cannot compare someone not liking autism to someone being racist, since it's out of my coworkers' control, and that I'm just making excuses to not see as many patients. Austin cut in here, saying that not only do I see many patients, it's possible I see even more and harder cases than fellow residents since I'm in internal medicine, which is a specialized field. Mia continued over him, completely ignoring what he said to say that there's no possible way for patients to turn me down because they should know that autistics are common in doctors, and to give me a single name of a patient that turned me down for autism reasons, as she put it. I told her that not only would I not just give away the names of patients, but even if I wanted to, it's a violation of my oath, and I would not do such a thing. She said again that I'm just making excuses and that I probably haven't seen enough patients to even use one of your special needs. I told her she was being quite stupid and that I've probably seen hundreds, possibly thousands of patients in the time I've been a resident, about 6 months, starting my residency last July, and that I have in fact had to use accommodations and that it's been more than a few times that patients have asked for my attending. I also mentioned that residency in internal medicine, mine specifically in oncology, can be incredibly difficult because consulting with patients that are often already distrustful of doctors is stressful for both the patient and the doctor. She said that thinking I'm above other doctors just shows my entitlement, and that I can't be a real doctor if I keep giving patients away to my boss. This is when I started to get much angrier. I am a real doctor. I did my time in school. I did all the work. I'm now doing my absolute best in my residency and learning as much as I can about internal medicine while fielding the insanities of oncology. I'm dealing with cancer patients day in and day out, and it can be exhausting. Not to the fault of the patient, but to the fault of a disease we barely have any answers to. To have someone, especially a family member, demean my work and disrespect me in such a way made me very angry. I told her that I don't think myself above any other specialty, but the fact of the matter is oncology patients have cancer. Cancer is stressful on the body and the mind. It also traumatizes the patients and oftentimes those around them. I also said that handing patients over to my boss is necessary some of the time when women, understandably so, don't want to deal with another male doctor, especially an inexperienced one. Most of those women are women with breast or cervical cancer who don't want me demeaning them as others have. Mia tried to argue that oncology is easy, since cancer is obvious and easy to fix. She then went on to say that the women were being stupid trying to ignore doctors. I told her that oncology is in no sense of the word easy. I'm treating old patients who sometimes don't even understand what I'm telling them and the caregivers of those patients who are heartbroken. I'm dealing with people in their 40s and 50s who are in denial about their disease, or simply refuse to believe me when I say they have it. I have patients refusing treatment and demanding more treatment at the same time. I'm treating children with this disease who understand more about death than a child ever should. I'm trying to help the parents of those children who are looking at me for answers to their questions that I do not have. I'm referring some patients to hospice and others to remission treatment. I'm taking former patients back in with them feeling hopeless because they were cancer-free for a decade. I also went on to tell her that the women who come into my clinic are often well past the point of not trusting male doctors because it was those doctors who turned her away with a diagnosis of anxiety or depression when she actually had late-stage breast cancer and needed a complete mastectomy. Or the women who were told it was period pain and to deal with it when it was actually uterine cancer, and now she's no longer able to have the children she told me she was dreaming of since she married her husband, and that she thought they were just having a harder time for the 10 years of trying they did. And those are the patients that kept me as their doctor. I have not a clue what happened to the women who asked for a female physician or my attending doctor instead. At that point, my mother piped in saying that we needed to stop fighting. She didn't say anything to my sister, but looked at me and said, "Hakan, it is time you stop being prideful of your job. I understand that being a doctor is a big deal for you, but you do not get to wave around your degree like it makes you any more than the rest of us." I will say I was shocked. I did not think I was being prideful, and was ashamed my mother believed me to be so. I would think myself modest of my accomplishments. I realized that I worked harder for them than others might have because of the setbacks I faced due to the language barrier and dealing with the autism diagnosis. I am not generally a prideful person, though. There have been moments where my father has pulled me back in, but that is true with every son of every father. My mother had shocked me into silence, but had not done so for Austin. I do not remember much else except for Austin telling me it was time to go and my father laying a hand on my shoulder before I left. Since then, I've been thinking of what to say to my mother. I do not want her to believe she's raised in a modest or callous son, as she's always valued modesty and independence above anything else. She was the reason I was able to work 2 jobs through medical school and still know how to function. She was the one that pushed me out to live by myself with a roommate against my psychiatrist and father's advice. I owe her and my father a lot, and I don't want to disappoint them even being the age I am. My father so far has been the only one to reach out. I've sent my mother and sister my normal texts throughout these 2 weeks, and neither have responded. My father, Austin, and I went skating a week ago, and he didn't mention anything, so I didn't either. I don't know if he agrees with me or not, but he's never been very vocal when he disagrees with my mother. Any advice would be appreciated, even if you feel it is blunt.